So we had a question from somebody who works in primary and pediatrics field, and they wanted some insight on the way to code the new 96161 and 96160 within E&M because they were getting denials. So Beth asked this question. 96161 and 96160 were codes introduced in 2017. They're, of course, in the medicine section, and they are behavior and health assessments. So they are primarily used in primary care, pediatrician. You may use them in an OB office as well. So 96160 is the administration of a patient-focused health risk assessment instrument, such as a health hazard appraisal, with scoring and documentation per the standardized instrument. 96161 is administration of a caregiver-focused health assessment instrument, such as a depression inventory, for the benefit of the patient, with scoring and documentation per standardized instrument. And I'm sorry I didn't bold that. That for the benefit of the patient really becomes important when we're looking at the billing aspect as to who that is going under. So that's something to keep in mind as to what insurance carrier is sending that to. So it's not just for mental health. This is per the CPT book. It says that this assessment is not just for mental health, but for the psychosocial factors important to the physical health treatments. So providers are looking at patients who are coming in with a primary illness, but benefit from these assessments and interventions that focus on other factors of CPT. So they came out in 2017, and originally they were add-on codes and not allowed to be billed with an EM service. But the American Academy of Pediatrics, the AAP, they got involved with CMS to resolve that issue, and the codes are billable with a typical outpatient evaluation and management code, preventive medicine code, or other E&M code. So that originally in 2017 when they came out, you may have had denials, and then they retroed it. So if you're looking at like a Medicare patient, 96160 cannot be billed separately. If it's billed with a preventative service or an annual well visit, you cannot bill for that code if you're already coming in and billing for the well visit. So to be eligible to report these codes, there's a couple different requirements that they ask. So the practice expense, practice must incur an expense to administer that instrument. So whether it's the nurse's time to do a query or the purchase of a screen or a device. They also, it needs to be standardized. So that instrument, either the nurse or the screen, you're looking at validated tests that are administered and scored in a consistent or standard manner. So it has to be a typical manner to get that information. It must be scoreable. And the results are documented in the medical record of the patient, so not the caregiver. So if you need to make sure that they're going under the patient's information. So these are a health assessment. They're looking for yes and no responses that indicate a patient's risk for adverse health outcome. So this isn't the form that you're filling out when you go into the office. This is our yes or no questions. So 96161 is going to be reported to the patient's health plan as part of a benefit. So their example was maternal depression screening is billed under the pediatric patient. So you don't bill it under a mother. It's part of the child's visit as a benefit to that patient. So the American Academy of Pediatrics does give an example of a situation. So if the mother of the patient and was coming in and the encounters for a breastfeeding related condition, then the indications of her symptoms or versus routine screening for the depression inventory, they're going to determine if that code can be reported. So 96160 for the depression screening, if the mother is the patient and depression is suspected, or you're going to use the 96161 if the encounter is focused on the baby and there's a concern for that maternal depression based on the postpartum score that was done. So they added that information, but it's to be billed under the baby and not the mother. So what I found looking to give you the best information about this code is many insurance carriers have their own schedule for these services. So just searching Blue Cross Blue Shield carriers, they might pay the service, while some Blue Cross Blue Shield carriers don't. I think I pulled up like Massachusetts, Texas, Alabama, looking through a lot of the different carriers. It just depended. They all make their own rules sometimes. Some medical assistance plans paid it and some didn't. Some only pay it for a child. Some only pay it, it just depended upon the circumstances. They might pay the 96160, but not the 96161. So it just depended upon the insurance carrier. So verify with your carriers of your state if they will allow it. And from what I found, the fee schedules, they're minimal. So hopefully your office isn't taking up too much of an expense with the nurse time or a screen of some kind, a tablet, because they're reimbursable at about $4.60, I think was the reimbursement rate I was finding for some. But again, that is dependent. So check with your insurance in your state, with your typical carriers, and see if this is a code that they're going to pay.
I was muted here. I was talking. That's fantastic. And that, again, I think goes back to what I had said too. Depends state to state. What do they want? Make sure that you're keeping your lines of communication open with your payers.
Do you need more medical certification and business training? Learn more at www.cco.us.